Viewers, how are you? My name is Danish Shaza and I am an HSE professional. Right now, I am going to discuss the factor to be considered when assessing risk in confined spaces. Having studied some examples of where confined spaces might occur in workplaces, we shall now look at the precautions, including emergency arrangements to be taken when working in confined spaces. Factors to be considered includes access arrangements, likely atmosphere to be encountered, persons at risk, task, materials, equipment, methods, methods of working, hazard inherent in the plant, hazard inherent from neighboring plant, reliability of the safeguards including PPEs. Well, access arrangements means first of all justification of need for safe access or justification of the need to enter the confined space at all. Consideration of whether the work could be carried outside the confined space. And the next thing is access and egress. It should be under safe system of work, usually a permit to work system, which may involve use of approved breathing apparatus if dangerous fumes are present in or oxygen deficient. It authorization to enter by responsible person, and then use of a belt or harness with a rope securely attached, then employment of person who is capable of pulling the worker out of the confined space to keep watch outside and hold the free end of the rope. The third access arrangement include removal of contaminants, means purge pipeline and tanks using inert gas. In case of sewers, it may be enough to lift manhole lids along the line of work to allow lighter than air gases to escape. The next thing is likely atmosphere to be encountered in confined space must be assessed. Means continuous monitoring may have to be carried out to ensure that atmosphere does not change whilst the working is being carried out. Monitoring may be needed to check for some of or all of the following, means oxygen content. Second thing is presence of flammable or explosive atmosphere, and third thing is presence of toxic contamination. Testing of atmosphere should be carried out before entry is allowed. Test samples should be taken from whole volume of the space. Since concentration of gas may vary, any person entering in the confined space to carry out tests should wear breathing apparatus, safety harness, and lifeline. Resuscitation equipment should be ready for immediate use. The third thing is persons at risk must be assessed. Mean when assessing the risk associated with entry into and work being carried out in a confined space, it is necessary to consider who may be put at risk by the operation. Are those entering the and working in confined space lone workers, or will a number of people be involved? And what type of work is being carried out, then how experienced are the people who are working in the confined space, have they received any training with working in confined spaces, do any workers suffer from any medical condition that may be affected by working. Thing is task, means work needed to be done must be assessed. The assessment should consider whether the task to be carried out will increase the risk to persons working in confined spaces. For example, welding could reduce the amount of oxygen in air. The fifth thing is material. It is necessary to consider the materials that will be used. Cleaning with solvents or carrying out painting operation could produce an explosive atmosphere. The use of powder would produce large amount of dust. And then equipment assessed means any work equipment being used should also be part of assessment. For example, trailing leads from electrical equipment can increase the chance of trip. Mechanical equipment could increase noise and cause problem from exhaust emission. Then method of working must be assessed. Then hazard inherent in the plant and hazard inherent from neighboring plant must be assessed before work to be started in confined spaces. The last but not the least assessment process is reliability of the safeguards. It must be assessed, including PPEs. An important part of the risk evaluation is to look at the controls of the safeguard already in place to check that they are doing the job effectively or whether more needs to be done. Safeguards associated with entry into or work being carried out in a confined space may include access and egress, ventilation, avoidance of ignition source, PPE or breathing apparatus. Means access and egress means this should include suitable means of getting into confined spaces and getting out, particularly in the case of an emergency. Access or egress may be by means of ladders, scaffold, or tripods and harness. And also consider, are the means of entry properly maintained? Then ventilation. If ventilation is provided to ensure a safe working environment, is it working effectively? Then avoidance of ignition source. Is all equipment in good condition, well maintained and properly used? Whether there is a possibility of flammable atmosphere? Then PPEs or breathing apparatus. Is the PPE and any BA that is used suitable for the task kept in good condition and being used properly by trained workers? This is it. In addition, in any safeguard associated with the work to be carried out in confined spaces must be assessed for suitability in the end condition. This is it for the topic of the factors that must be assessed or considered to before assessing risk of confined space. Hope you have understand the conceptual detail with respect to occupational health and safety. Feel free to contact in case of any query. Thank you.